an MD, and all my life I was going on and making the grades, doing everything, doing what my parents said, but then also going to volunteer at all these different hospitals, and I volunteered with different doctors. And in the end, it's funny because I came home and I was sad because when I was at the hospital, a lot of people were dying, things like that, and so I was becoming really sad. But I came home to my husband and, well, my boyfriend at the time, and his dad was a dentist, and his dad said, why don't you try dentistry? I thought, why would I do that? That's gross. But then I went to go visit him, and sure enough, I said I'd visit everybody else. I observed everyone else. Why don't I, see what you do? And I will say, I came in, and there was a child there, and he was crying. And he had broken his front tooth. He was about 13 years old or so at that age where, we kind of worry the way we look, and we're worried about the way we look, and worried about what people think. And my dad got him out of pain, created this brand new beautiful tooth, and I thought, oh my gosh, the kid went from crying to smiling, and sure enough, I was thinking, wow, that was amazing. And so I said, okay, that's it. So I went to dental school. So I did dental for such a long time, literally dental for 20 years, and I love dental. Don't get me wrong, I love dental. But then things changed, and it's going to come later in this presentation, but I was introduced to sleep. And when I got into sleep, I fell in love with them even more. And so everything changed from there. So that gives you just a little bit of my background. But ultimately, why do I do what I do? I've always known I'd like to help people in any way, shape, or form, whether it be educating or helping in what I can do. Every time I meet patients and people, I think, okay, what if they're my family members? Every time I look and I diagnose and I treat, I think, how would I treat my family members? Because my family is everything to me. I have one boy, and trust me, I've tried many, many times to have more children. I wanted 4 children, actually. But God, whether you believe in God or not, God did not give me a divorce. I actually had 7 miscarriages. I had one that I gave birth to a daughter, Lily, and she was my world, but she was the first time I ever felt death. So that was really, really hard. It took a long time. And so when I think of sleep and sleep apnea or other sleep issues, and I think about patients and what they go through, I always think about that and how I felt. So every time I treat patients, I think they have sons, daughters, husbands, and wives that depend on them too. And so every time when I'm looking at patients, I think of my family, and I think, what if they're mine, and how would I treat them? Okay. So let's on a more happier note. Sleep disorders, that's what we're all coming here to speak about today, correct? Sleep disorders. And so there's so many different sleep disorders. There's actually like 80 of them, but I'm going to go over the top 5, okay? And so we have normal sleep disorders are insomnia, narcolepsy, parasomnias, like sleepwalking, sleep talking, night terrors, restless leg syndrome, and obstructive sleep apnea. Do any of y'all know of anyone that might be suffering from any of those things? Yes, you do? Okay. And so what are they suffering from? Is it you, or is it your family member, or a friend? Lifelong insomnia. You've had insomnia for a long, long time? Okay. Have you had any treatment or anything like that? No, drugs? Yes, that's part of it. What about you?
Sleep apnea.
Yeah, sleep apnea. Okay. So we're going to be discussing all these things, all right? So let's start with insomnia. I'm sorry, what was your name? Heather. Okay, I'm Suzanne Thai. Nice to meet you, Heather. So insomnia. So what's insomnia? Insomnia is when you have trouble falling asleep or staying asleep. Do any of y'all suffer from this? If you're not able to go to bed on time? Yes, and so it can be very hard to fall asleep. And so a lot of times, well, what have you done? Can you give me some examples of what you've done to try to help yourself fall asleep?
Reading. Medication.
Medication, okay.
Podcasts.
Good. Anything else?
White noise.
White noise. You are all doing things things correctly, okay? Anyone else? No, okay. So let me kind of explain. First of all, insomnia, it's when people can't fall asleep. There are a number of ways to help you fall asleep. It's actually based on 3 things, okay? Sleep. When people can't fall asleep, based on 3 things. One, it could be because it's light. So if you have light in the room, if you're watching your phone, if you're watching your TV, then that blue light comes into your brain, tells the brain not to release melatonin, because melatonin is what helps us start to fall asleep. And so it activates that, and it does not release melatonin. So when we don't have melatonin, it's very, very difficult to fall asleep. So light. So then if you, a lot of people will watch TV before they go to bed, they'll look at their phone, they don't realize how much of an effect it has and how hard it is for them to go to sleep. So like how you said you listen to podcasts, I love that. I love that because it's not light. And so listening to podcasts, listening to things, the Calm app, things like that, that's very helpful. The other thing is not just light, but also temperature. Do you guys keep your room warm, cool? What do you guys? Warm? Cool? Which one do you think is better for you for sleep? What is that?
Cold.
Cold? Yes, cold. So cold is definitely, that is the answer. But some people like it warm. So you're saying warm. I'll tell you, my husband and I, we do not agree in temperature at all. So he likes it freezing, and I'm freezing. It can be 103 degrees outside. I've literally got a hat on, I've got a scarf, I've got a blanket, and he's just so cold. So the way to help that, because cooler temperature does decrease that body temperature, and it helps you fall asleep faster. They want,
I'm going up front.
Sleep physicians will say they want it about 64 to 69 degrees if you can handle it. Obviously, if you can't, let's go a little, make it more comfortable, but cooler temperature always helps you fall asleep easier. Do you sleep with cooler temperatures? No. Do you like cooler temperatures, or do you like warmer temperatures? Warmer? Just make it comfortable. And then, warmer for you might be, still cold for you, okay? So cooler temperatures, that's one thing. The other last thing is stress. How many people have any stress or think about things all the time? And your brain's running and running and running over and over again, right? So a lot of people suffer from that. We have stress, not just with work, but stress with our family, stress. We're not even stressed, we're just thinking about the next day. What are we gonna do? What do we need to get done? And so there's something called brain dumping. Does anybody do brain dumping? So, what is brain dumping? Brain dumping is, so when you get to bed, you have a pad, like a legal pad or a journal or whatever it is, and everything that your mind is thinking about, you start dumping on that paper. You write everything down. And sometimes the reason why people can't fall asleep is because their brain is constantly thinking of solutions. Or, I don't want to forget it, because if I sleep, I'm going to forget it, so keep thinking about it over and over again. So then write everything down. I don't care if it's, what am I going to wear to bocce tomorrow? Whatever that may be. You want to write everything down, and then if you have solutions to it, write the solutions. And then after that, circle the top 3 things that you will make sure you accomplish tomorrow, the next day. And then when you go back to bed, look at your paper, look to see, did I accomplish those 3 things? I did. And I accomplished like 4, 5, 6, 7 other things I didn't even realize I did. And so people can go to bed feeling a sense of accomplishment. A lot of times people go to sleep and they think about the day, or they think about things, and they start to get anxious, or they get sad because they feel like they weren't accomplished. So you'd be surprised how much you actually do, but it has to be tracked and has to be written down, okay? And so whenever it comes to insomnia, how do people know that you have insomnia? So symptoms, and you telling your doctor, I think I have some insomnia and have a hard time falling asleep. But I will tell you, if you can take some of these tips and tricks that I told you, maybe you don't have to go to the doctor and tell them these things, because you might be able to fall asleep faster and better. And I know you said medications, and it's true. If you try all these things and nothing helps, then yes, they can talk about medications and give you, for sure, that can help as well. So doctors a lot of times will ask you to do a sleep diary. Whenever you got the medication, does the doctor ask you to do a sleep diary at all? Meaning, what time you go to bed, how many times you wake up in the middle of the night? Do they ask you to do that before they give you medications?
I did medication, I did CBTI,
You did
and I've got a
CBTI.
business model.
And so you did CBTI help you at all? It failed? CBTI can be tough. It's known, from the sleep physician world, it's known to truly help, but it is not easy. The way the CBTI works is they cut out the number of times that if you want to go to bed so badly, they say, nope, don't go to sleep. Do you remember them saying that? Like, don't go to sleep, don't go to sleep. And you have to kind of change your cycle, change your time of going to bed to where you're so tired that you can't help it. But a lot of people do, a lot of sleep physicians will recommend CBTI, and if you can't do it, then they'll start to result in medications. Are your medications helping you now?
It's been a 25-year process. And I've become very much aware of the medications, what's out there, how they affect the brain, how they affect your body. And pretty much all of them are going to develop tolerance over time. So you have to be so careful.
And you do have to be careful. I mean, I'm not here to tell you what you can or can't do. I'm Asian. I'm very holistic. I like things as holistic and as natural as possible. That's me. However, I 100% believe in medications when everything else has failed. And I'm so sorry. I know it sounds like you've been battling for 25 years. That's a long time. Are you doing the whole thing about the light and the temperature?
Way over that.
You're way past that stuff.
My situation may be genetic. My mother had Parkinson's.
It very much can be genetic, for sure. And so, yes, sleep physicians are usually who you see if you have that issue, but anybody else who hasn't gone to the links that he has, what's your name? I'm so sorry?
Ron.
Ron?
Yeah.
Ron. Anyone else who hasn't gone to those links that Ron has gone, then I would definitely try to do some of the things that I've discussed. Yes, can I?
I'm sorry, I don't know what CBTI is.
Your CBTI is cognitive behavioral therapy for insomnia. That's what it means. Cognitive behavioral therapy for insomnia. So a lot of times there will be an app, so there's a place where the sleep physician will send you so that you can, not a place, but like on your phone, and it'll guide you. Today, you sleep, you go to bed this time. Tomorrow, you go to bed this time. And they kind of push it to where you're so tired that you're resetting that clock and then you're starting again. And so it kind of gets people back on track. But for Ron here, it might be a little bit more severe, and so he's going through medications. And I'm not saying that severe your medications, but when people are so tired, they're going to do anything and everything. So I'm saying if you're not in that severe case, you can try those 3 things that we discussed: the light, no light, cooler temperatures, and rain dumping. Let's see how far that can get you, okay? All right. And so narcolepsy. Does anybody know anything about narcolepsy? Or do you have narcolepsy as well?
No, but I know about it.
I'm sorry, you know that. Okay, good. So you know you have narcolepsy as well. So narcolepsy is when you are excessively tired. Does anybody feel tired throughout the day?
I do.
You do? Do you feel tired even if you slept for 8 to 10 hours, something like that? You still feel tired? Yes? No? Yes? And so all of these sleep disorders, people are feeling tired. So this is one thing that could possibly be it. So feeling excessively tired. But then it's also where you can fall asleep suddenly out of nowhere. And so cataplexy. So what's cataplexy? Cataplexy is loss of muscle tone. A lot of the narcoleptic patients will have cataplexy. Have you ever talked to somebody and all of a sudden, poof, they're out? Have you ever talked to anybody and that happened? Never? So you may not have ever met someone who has cataplexy or narcolepsy. That's what they suffer from. They can just automatically just fall, and it can be very, very dangerous because you don't know. We could be talking, all of a sudden I fall out, and I could definitely have cataplexy, okay? And I'm sorry, or driving. That's what's really scary with sleep disorders is driving because you don't know what happens, and all of a sudden, boom, they're out. And so cataplexy is part of it. There are the people with narcolepsy, a lot of them will take multiple naps in the day. It won't be just one nap. It might be 3 or 4 or 5 because they're so extremely tired. And of course, getting tested. They have a nap test called the multiple sleep latency test. And so your doctors will figure out, once you talk to them about your symptoms, they'll say, okay, I want you to go take this MSLT test, this multiple sleep latency test. And it just measures to see how quickly you fall asleep and how fast you get into REM. They do that, and then that's how they decide whether or not you have narcolepsy. There are medications for that. Have y'all ever heard of Provigil or Lumryz? Have you ever heard of those? Yes? And so those are some of the main ones that they prescribe. But it's supposed to help you stay awake and improve your nighttime sleep. And usually this treatment is long-term. All right, parasomnias. These are always so much fun. So parasomnias, does anyone here sleep talk or sleep walk? Anybody talk in their sleep? Oh, no one talks in their sleep. This is one of the first few rooms up here. What about sleepwalking? Anybody do any sleepwalking? When you were younger and not so much now? Well, good, I'm glad, because sleepwalking can be very dangerous. And so sleepwalking, and the reason why sleepwalking can be dangerous, of course, because you don't know where they're going to go. I have patients who have kids and they're just sleepwalking and they're so worried. My uncle, when they lived in Vietnam, he would go out into the balcony and he'd put one foot over the balcony and the whole family would just freeze, because that's really what you want to do. You don't want to kind of wake them up or startle them. You let them do what they do. For some crazy reason, they know not to jump. And so he didn't jump off, but it was very, very scary. So sleepwalking can do that. So when you have patients, or if you have friends or family that might do it, this is something you can educate them on. Then when they sleepwalk, you want to make sure that if they know, meaning, let's say a mom knows that her son sleepwalks. If you know your son sleepwalks and goes to the kitchen every time and comes back out, make sure there are no sharp corners, nothing that they can hit, because they're not paying attention to that part, okay? So you want to be very, very careful about where they're walking. That's also with night terrors, same thing. Night terrors are people who have, dreams, really, really bad dreams. But a lot of this can be genetic. A lot of this can be stress-induced. There are different ways to help that. So breathing techniques is really good, getting you relaxed and less anxious. So do any of y'all do any breathing techniques before we go to bed? No. So we're going to do some breathing techniques today, okay? Are y'all ready? You didn't know I'd have you work a little bit, huh? Okay, so breathing, you'd be surprised how important breathing is, and breathing the right way. There's a book called Breath. Have y'all ever read it? Or seen? I highly, highly recommend it. It's called Breath by James Nestor. It's the most interesting book, and it's crazy how many problems or issues were solved by correct breathing techniques. And nasal breathing is what we really want. Do a lot of y'all, can you breathe through your nose? Okay? Can anybody not breathe their nose very well? You have a hard time breathing through your nose? Yes? I'm sorry?
Yes.
Yes?
I'm wondering about, well, you're not where I'm interested yet.
Okay.
Histamine, I just get stuffed up, and I have stenosis. And my neck hurts like hell at about 3 in the morning. Okay, I don't know if I'm in the right pew here. This is not your bailiwick. Maybe, I don't know.
No, we'll talk about that. So you have pain in the neck,
Yeah.
right? And so sometimes pillows can be affected. Sometimes people have pain. We'll get more into that too, because when you have pain, it does affect sleep. But if you can get into good REM sleep, people love REM sleep, because REM sleep is that tonic phase of sleep where we're frozen, right? And so a lot of people have pain who have had surgeries. They love to go to sleep if they don't have sleep apnea or any other sleep disorders, because they can get into REM and that tonic phase, and all the sensory issues of pain kind of go away, or at least they're lessened. So you might have something going on, because if you can still feel that pain a lot when you're sleeping, then that might be an issue, okay? But nasal breathing, I highly would recommend doing something about that. If it's antihistamines, of course, help with that. But that you also want to see, if you can't breathe your nose, that can really cause a lot of medical issues for you later on. So, Breath by James Nestor, all right? Breath by James Nestor, which is such a great book. But what I want you to do now, let's practice breathing, because if you can take this home with you today and start doing this all the time, you might see your blood pressure start to decrease, you might see other things health-wise start to get better. But it can also help decrease any sleepwalking, sleep talking, night terrors, things like that, and calm you down and help you fall asleep faster. So what we'll do is, I'm going to tell you, and then we'll do it all together. We're all going to do it together. So we're going to breathe in for 6 seconds, we're going to hold it for 4, and then we're going to breathe out for 6 seconds. Don't breathe out fast. Breathe out slow for 6 seconds, and then hold it for 4. Breathe in. Are we ready? Let's do it. Breathe in. 1, 2, 3, 4, 5, 6. Hold it. 1, 2, 3, 4. Now breathe out. 1, 2, 3, 4, 5, 6. How'd y'all do? Was it hard? No? Who's snoring over there already? Are you snoring already? So yeah, so breathe in, and I want you to try this all the time. But the other thing is, when you're breathing, it's not just, you want to breathe and your stomach, and you should feel when you're breathing that your stomach should be coming out, almost like a balloon, right? Because we're working that diaphragm, and it's increasing lung capacity, okay? So if you're breathing very shallow, we need to practice breathing. And breathe through your nose, and then out with your mouth, okay? So when you breathe through your nose, let that stomach expand, and then out with your mouth, okay? So try that can help. And the other thing is to help, relax yourself is muscle relaxation techniques. So what those techniques are, it's a step-up technique. So you can start with your toes, for instance, and you're gonna tighten them, and then release. And then you go to your calves, and you tighten and release. And you keep going through every single body part that you have, all the way up to your fingers, tighten, release, and that also helps. So breathing techniques and muscle relaxation techniques, okay? And those all can help reduce stress, and it's good for bedtime routine. Now, restless leg. Does anybody have restless leg? Restless leg syndrome? So, restless leg is an uncontrollable urge to move your legs, especially at night. And so it definitely disrupts sleep. Do you feel like you're waking up multiple times in the middle of the night because of restless leg? So a lot of sleep apnea patients have restless leg because they're kicking, they're moving, and it's waking them up. We want non-fragmented sleep. Have you ever had sleep and then someone keeps, touching you, waking you up? How do you feel when you wake up after your long sleep? Do you feel tired, rested? Yeah, you feel like you want to punch them, right? Because they're constantly trying to wake you up. And so that's, restless leg can kind of feel like that because every time you sleep, then you're kicking and you're moving, and it's what they call almost like an arousal to get you to wake up. So we don't like it, it's very uncomfortable, but a lot of it can be diagnosed by your symptoms, by you telling your doctor. Usually a neurologist is really good to go for. But sometimes you can have a deficiency in iron, and so taking iron supplements can help. Also, decrease in caffeine, alcohol, and nicotine intake. So I know the one that said beer was exciting, but and sometimes that can be hard because it doesn't help when it comes to sleep. So like the sleep, they say that alcohol, it takes 1 ounce of alcohol, 1 ounce to 1 hour. So 1 ounce of alcohol takes 1 hour to metabolize through your system so it's not affecting you when it comes to sleep, okay? So you know that. Now, again, to help with this, normal bedtime routine. What I have discussed before, the breathing techniques, the muscle relaxation techniques, that can help. Also, a cool environment, like what we discussed, and of course, stretching and massaging. You massage your legs, wear compression socks, things like that. Yep, that can help. Those are all things that can help. So hopefully you're all, if you know other people who have restless legs, you can tell them what you learned today, okay? All right, and of course, medications can be taken like Propinerol. That's another one, and taken as needed, not all the time. Okay, so the most common sleep disorder is obstructive sleep apnea. And obstructive sleep apnea, do you all know what that is? No one knows what obstructive sleep apnea is? Oh, you do know what it is? Yes? What is it?
That's when you stop breathing at night when you're sleeping due to
She's perfect. If you stop breathing at night when you're sleeping due to an obstruction of your airway. Thank you for that great answer. Here's a lottery ticket. We're not lottery, but a little scratch off, okay? So people want to participate. And I know some others participate, just come up to me. We'll get you something. But yes, that's exactly what it is. So obstructive sleep apnea. Sleeping without breathing. Apnea, that means without breath. Okay, so sleeping without breathing. So it's as simple as this. We need oxygen to live. That's how simple it is. Without oxygen, our brain, our heart, our lungs, our body can't function. So if you have medical conditions like hypertension or diabetes or weight gain, things like that, it doesn't matter what treatment you're taking, what medications you're taking, it will not be as successful if you're not giving oxygen to these organs that need it, okay? And so, like she said, it's a blockage for obstructive sleep apnea. It's a blockage of airway, not the tissues in the back of your throat. And for it to become obstructive sleep apnea, you have to stop breathing 10 seconds or longer, all right? But if you go home and you close your mouth and don't breathe, if you stop breathing for 10 seconds, you can start to feel, okay, I'm feeling a little bit anxious here. Your body's gonna feel like, I don't really like this, but you know what's so surprising is some patients stop breathing for a minute. And can you imagine holding your breath that long? What do you think is happening to your body when that happens? What do you think? What is that?
Cortisol.
Yeah, exactly. Large amounts of cortisol, lots of stress, right? And so, there you go. Thank you for answering my time. Thank you so much. But cortisol, yes. And so increases of stress. So what happens is stress causes inflammation within the body. Inflammation causes disease, okay? Disease, and I don't know if you can see this, but you all have a paper there of all these different things that can affect your body. And a lot, it's all due to inflammation. And so sleep apnea is such an inflammatory issue that people can have hypertension, diabetes, sexual dysfunction, weight gain, all these things. Have you ever had a condition where none of the doctors can figure out, they can't tell you why, and they've checked everything out and they still don't have an answer? Have you ever had that condition? A lot of times it really could be stress, okay? I'll tell you this, and because of stress causes inflammation, and I'll tell you this is what I think. I told you that I had 7 miscarriages, right? 7. And I feel myself a very healthy person. I go to the doctor, I do everything right. I feel like I eat pretty well, I exercise, all these things. But when I went to the doctor, I said, what is wrong? I did all the tests, nothing wrong with me. Nothing. I just kept losing. And all I could think about, because when I was losing, was when I was having practice in the business, and it was very stressful, and I was stressed all the time. That's the only thing. Every time I miscarried was when something significant happened, and then I miscarried. So stress has a lot to do with so many different things, okay? So here, that's what obstructive sleep apnea is. So signs of sleep apnea. Snoring. Snoring is one of the biggest reasons. How many of you snore? Are you willing to admit it? Oh, you're so good. So yes, good that you're admitting it, but are you aware that snoring can be detrimental? Are you aware of this? And so I actually wrote a book, Snoring, the Clue That Could Save Your Life. And the reason why I wrote it is because I was trying to change everyone's thinking, and you all may not be this way, but the majority of people, they laugh, they joke, they make fun of, and all those things of people who snore, when really they don't realize what's actually happening. I'm sorry, it's a sign. That's right, it's a sign. So snoring, and I'm gonna have this one, I'm gonna try to do my demonstration here. So what's snoring? Snoring.
So you have an airway that you breathe out of, okay? Airway that you breathe out of. When you sleep, the tissues in the back of your throat start to block your airway. The tissues relax, they block your airway. When it blocks it partially, air flows in and out, the tissues vibrate, that is snoring. Snoring is partial blockage of your airway. It's like if I said, you said you might snore. It's like if I said, what's your name again? Dolores. If I said, Dolores, when you snore, you are partially blocking your airway. It's like, normally, let's say you breathe out a big old hose, you're getting good oxygen in, right? Good oxygen in when you're breathing out the hose, big hose. But when you snore, I want you to just breathe out a coffee straw. So imagine breathing out a coffee straw all day. If you're snoring all night, how do you think your body's going to feel?
Tired.
It's going to feel exhausted and tired. And it's like it feels like it's been running, right? Because it's not getting enough oxygen, all right?
And so snoring, that's why it's a clue that could lead you to believe that you might have sleep apnea, because that's partial blockage. But when these tissues completely block your airway, that's apnea. That's an apnea that is happening and not breathing. And that's when your whole body goes in fight or flight mode, and then we have that stressful state, okay? So Snoring, excessive daytime sleepiness. If you're really tired during the day and you don't understand, you slept for 8 hours, 10 hours, 12 hours, but still you wake up and you want to hit an alarm and another alarm, and you just feel like, I don't feel good. And during the day you want to take naps. These are all possible signs. Hypertension. Does anybody in here have high blood pressure? Yes, so a lot of people do have high blood pressure, but have you ever been tested for sleep apnea? Has anyone been tested for that? When they found out they had high blood pressure, or if you went to your cardiologist, did they say, you know what, let's look at sleep apnea. Has anybody ever told you to do that? Yes. And so nowadays, they're starting to. Back then, they didn't always, but now they are. I get referrals from cardiologists all the time, just because they say, Dr. Thai, I've done everything, I've given all the medications I could for their blood pressure, it's not getting down, it's not getting better. And so what can we do? We need to find out and make sure that this heart is not compensating over and over again to where it can't help with the medications. And so high blood pressure, how does that happen? You have a heart. The heart pumps at a regular rate, right? The heart's pumping to bring oxygen to your organs, to your brain, your liver, your lungs. That's what hearts function, okay? It gets the oxygen externally as we're breathing in and out, and then internally floating within our body. So then what happens is, when you stop breathing, all of a sudden the organs say, heart, where's our oxygen? You're supposed to be pumping it to us. And the heart says, I can't help it. This person's not breathing. And so what am I going to do? I can compensate. So instead of pumping at a regular rate, I'm going to start pumping harder, faster, and stronger. And I'm going fight or flight mode, okay? So when I'm pumping harder, faster, stronger, I'm going to push whatever little internal oxygen I have left here, push it up to my brain, all the way down to my fingers and toes. But what's happening to your blood pressure? It's going to start to rise, okay? And so it's going to rise. You could also get what they call atrial fibrillation. Does anybody have atrial fibrillation? Or know of anybody that does? So AFib. So AFib is an irregular heart rhythm. Well, the heart was pumping regularly until you stop breathing. Then it's like compensating, pumping harder, harder, harder. Goes back to normal. Compensates again, harder, harder, harder. So then it's irregular heart rhythm. So a lot of these patients, they'll be at the cardiologist and they'll say they have hypertension, they have AFib, they're doing everything, they had ablations. But did you know, if you have an ablation and you have sleep apnea, but you don't get sleep apnea treated, the likelihood of you having AFib again can happen within a year. It's like 80%, okay? So if you're having ablation, something like that, you want to make sure at least you don't have sleep apnea because you're trying to get to the core, okay? And so diabetes are a big one. Stroke. I already talked about atrial fibrillation. If you have anxiety or fatigue or cardiovascular disease. If you have obesity or weight gain, has anybody tried to lose weight with diet, exercise, things like that, but they can't lose their weight? Anybody have that issue? And so a lot of us do, and some people think, oh, it's our age. I mean, I have men that are in their 70s and 80s and they're fit, but they don't have an issue. And so their body's releasing hormones like it's supposed to. There's certain hormones called leptin and ghrelin. One tells you to increase your appetite, one tells you to decrease your appetite. But if you're not sleeping through the night, if you're constantly woken up because you stop breathing, then you're not getting those hormones. So no matter how hard you're trying with your diet, with your exercise, you're not losing the weight. And so it's a cycle. So I'll have again, weight loss doctors that'll say, well, Dr. Thai, I cannot get this patient's weight down. I've been given meds, all those things, and I can't. Does this patient have sleep apnea? Can we do something there? Because I can't go any further, all right? And of course, cognitive issues, memory loss. Is anyone suffering from brain fog, or they're forgetting their keys, or their memory loss? Anybody suffering from that at all? Why is that resounding like laughter, right? And so yes, so memory loss can be due to sleep apnea. And why? Because in sleep, we're trying to get to REM sleep. REM is where we can store our memories, but if we don't get to REM, then we don't get to store our memories. Because what happens is during the day, we start to build toxins in our brain. Toxins are built all day during the day. But then at night, when we sleep and when we get to REM, those toxins are rinsed off. And then now we have a fresh brain and we can remember things. But if you don't get to REM, then this doesn't happen. So people start to have memory loss. And so that's where that comes from. And then of course depression. You know, I talk about depression. I'm going back to, you know, my daughter. So when I had my son, my husband said, you know what, you're so happy. You're such a happy person, but why? We have a son, and we went through all of these things, and we finally have a child. Why are you depressed? Because I don't know if you can tell. If you look at me, would you think I was a depressed person? Because honestly, I'm really not. I'm super happy, high on life. I don't drink anything except for water, so no caffeine, nothing. I like love life. But when I had my son Connor, that kid, we were so joyous that we have a child, but he did not sleep. He would not sleep, and daily I was dying inside. I literally was dying inside. My husband said, what is wrong with you? He said, you should be happy. You have a child that we've waited for such a long time, and I couldn't help it. I didn't even know, my mental state was not the same. I just felt like I wanted to be done, and honestly, just done with life. And it sounds so crazy when I look back at it, it just sounds so crazy to me. I said, how could I even think that way? But when you don't get sleep, you're not the same person. So if you have husbands or wives, and they seem like they're depressed or they're anxious, it might be they might have sleep apnea. They're not getting good rest. And they don't need to be that person. They want to be happy. They want to be the person you marry, but they can't just because they're not getting good rest. Okay? And of course, nocturia. Nocturia is whenever you wake up multiple times in the middle of the night. Do many of you guys wake up a lot in the middle of the night? Yes? How many times do you wake up in the middle of the night? A lot? Like 3 times? At least? 4 times? You roll around, toss and turn. Do you all toss and turn in the middle of the night too? So tossing and turning, waking up in the middle of the night, these are all considered arousals, okay? And so with sleep apnea, like right now, we're all breathing just fine, correct? And so are you breathing okay? I know your nasal breathing is a little hard, but yes. But you can breathe, all right? So that's good. But what happens is when you sleep and you stop breathing from sleep apnea, the body says, oh no, what am I going to do? We're not breathing. But I do have an idea. I know that if I wake this person up, they'll breathe again, right? So what the body will do is really smart. It will create an arousal of some sort. And arousals are ways to wake you up. Arousals can come in many shapes or forms. Arousals could be tossing and turning, kicking, restless leg, grinding and clenching. It could be snorting, gasping, choking. Those are all considered arousals. So the problem is, when you're aroused, then you wake up. Well, people say, well, again, remember going back to why are you tired? You slept for 8 to 10 hours. Well, because we are not tired if we get good quantity and quality of sleep. So if you go and you have 8 to 10 hours of sleep, great. But you got the quantity down, but do you have the quality down? And the quality comes from, are we getting too deep in REM sleep? And you might think you are, but you really could not be. So if you're tossing and turning a lot and getting up to go to the restroom a lot, it's because your body thinks that you're awake or you need to be woken up. So when you're woken up, the kidneys say, well, I guess we're awake, we're going to keep churning and burning that urine, all right? So we're going to, let's go to the restroom. Or we're going to toss and turn because we're uncomfortable because we need to wake up, all right? So what happens is there's different stages in sleep. You have light, you have deep, you have REM. We want deep and REM sleep. But within light phase, there's 2 phases called N1 and N2, and it goes to deep and REM. So let's say you're drifting to sleep. You have to go through the cycle. So if you're going through N1, N2, but then you stop breathing, body's like, wake up, toss, turn, grind, clench, gasp, choke, whatever you need to do. Oh, we're back up to N1 again. And we were trying to get all the way down to REM, but we couldn't because you stop breathing, body's trying to wake you up to cause you staying in the light phase. Does that make sense, what I'm saying? Mm-hmm. That's what, yes?
I thought I was waking up because I had to go to the restroom.
Yes.
But that's what was waking me up? Because I take a blood pressure or medicine that's supposed to be low more?
Yes.
So it really wasn't just all maybe that?
I would not say that that's not the, what you're saying, medications can play a part, of course. If you're taking diuretics, of course they can make you go to the restroom. But You know, sleep apnea, I would never say it's the only reason why everything is happening, but it is the basics. It's like building a house. You want to build a house on concrete and not on quicksand, okay? Your concrete is your oxygen. If you don't have oxygen, nothing's functioning well. So, yes, your medications could be causing it. That's one of the things. But when you get into REM sleep, remember I told you REM sleep, the sensory issues are not going on, right? Your tonic phase. So a lot of people, even if they're taking medications, it can be decreased on the amount of time they get up to go to the restroom if you're actually getting into REM. Does that make sense? So that can be it as well. I also say, I tell patients to help them stop waking up so often because we're trying to get straight sleep, not fragmented. Every time you have fragmented sleep, you're going to be tired. Like I just discussed, if I keep waking up and she said, I'm going to punch somebody. Yeah, you're going to want to punch them because they keep waking you up. Well, that's what the body keeps doing, is waking you up because you stop breathing, okay? So we want straight sleep, but fragmentation is waking up. Yes, Mrs.
Kind of a general question. When should you stop hydrating at night, drinking water for the next one? No.
Did you read my mind? That was literally what I was about to say, right before you asked me that question. So yes, so you should stop hydrating at least 1 hour, 1 to 2 hours before you go to bed. Because if you don't, trust me, you're going to want to go to the restroom. And so I always tell my patients, I'll say, let's look at this. I do sleep diaries all the time. What time did you stop drinking anything? Because if they're awake, I had a gentleman, he wakes up 15 times in the middle of the night. 15. Can you imagine waking up 15? It's crazy. And so then after, he still, even after seeing the urologist, he was going down to 6 times. And then the urologist said, you still need to go see Dr. Thai. I can't get it any better than this. But 6 times is still a lot. And he's going to the restroom, not just waking up out of his sleep, going to the restroom. And then I treat him the way I treat him, and I'm going to show you how I treat him. And then I saw him 2 weeks after treatment, and I said, how many times are you waking up? He goes, you know what? Crazy, because I tell everybody to write in their diary. He goes, 0. I don't wake up at all. And so he's super happy, but he was skeptical at first, and I'll show you what we do. But he was very, very skeptical at first, but then when we logged it and we talked about it, he was like, yeah. And then we looked at the snore. I do a Snore Lab app to listen to snoring. And he was just, he didn't want to be here. He's like, I'm only here because my urologist sent me. I don't want to be here. And he was very upset. And I said, well, you don't have to be here if you don't want to. But he says, no, I'm forced. My wife's making me to. I'm here. The snoring's driving her nuts. She can't handle it. So I said, okay. So we talked about it. And so during the whole treatment, I said, let's listen to your Snore Lab app. I have an app that listens to your snoring. And we listened to his snoring before he started treatment with me. I mean, it was like what you were doing just a second ago. Like, all that big snoring. And then after, I listened to it, and it showed the snore score really high. I'm thinking, okay, that's different. We're treating, why does it look like it's worse? And when I listened to it, it wasn't because he had stopped snoring. It was just he forgot to turn off the app, and him and his wife were talking, so I was recording all these things, right? But yeah, so there's help that can be done. And of course, sexual dysfunction too. We get lower testosterone levels when we have sleep apnea, so that does affect sexual dysfunction, all right? All right, now this is kind of fun. Oral indicators. So, do you all have a phone that you can take a picture? Do you all know how to take a picture on your phone? Okay, do you all know how to take selfies at all? Yeah? Will you go ahead and pull your phone out and just aim it towards your mouth, okay? And I would like for y'all, whoever pulls their phone out, I'll give you oh, there you go. And so take a picture of your mouth, and I want you to do this. This is going to be fun. Ooh, Melissa, can you please take a picture from this front side with everybody? And so what I want you to do is when you have this phone, I want you to do this. Stick your tongue all the way out. And there, see, I'll get with you. I'll be in the picture with you doing this. I don't know how professional that is, but yes. And take a picture when you stick your tongue all the way out. And then take a picture where you can see the back of your throat, okay? I want you all to take a picture. Okay. Yes. And he's doing a great job. You're all doing such a good job. Very good. Take a good picture so you can see the back of your throat. All right? And then I want you to stick your tongue in your mouth and just go, and look at the teeth and look at the bottom. Take a picture and see if you see anything with the bottom teeth. and down here also, okay? Good, good. So we're going to look at some intraoral indicators that maybe you could possibly have sleep apnea, okay? Now you have your phone, you can go back and look at it and see, okay, do I have what she's saying? All right. So, first of all, we're looking at redness of the soft palate and uvula. So do you all know what a uvula is? Yes, you got it, you got it. So uvula is that little punching bag in the back of your throat, right? When y'all looked at your pictures, how many of you could see your uvula? 1, 2, 3, 4, 5. Yes, you can see your uvula? Good, that's a good thing. Now, could you see the whole entire uvula? Or was it like hiding behind? Whole thing, good. So the patients or the people who took the picture and they can't see their uvula, that is a sign that possibly you don't have an open airway, because you should be able to see your uvula when you open your mouth. You should, when you stick your tongue out, you should see that little punching bag, okay? And then, if you look for like a narrow and high palate. So let me just go through this here. So narrow and high palate. If you know anybody, if you think have the same thing, if your teeth look kind of like, there we go. Crowded like this, it's more of a V shape up top instead of more of a wider look. This is normal. This is more narrow. Can y'all see the difference between these two? So a lot of crowding too, because when it's crowded like this, people will have cross bites. They will have the teeth where there's just not room for them to come in. So very, very crowded. This is an example of someone who could have a high risk of having sleep apnea, okay? Now, when I had you take your picture, I want you to look at your tongue too. Does your tongue sit above the teeth, or does it lay below the teeth? If it sits above, that means it doesn't have the most room to be there, And so what happens is when you don't have enough room, it will start to fall back. And when it falls back, that's when you start to get blockage of airway as well, okay? Now look at this, tori mandibularis. You know, I was telling you, look at the bottom. So if you have these, you see these little humps right here, these bumps at the bottom? This is very indicative of people who grind, but also do you see how it's kind of taking the space of this tongue right here? The tongue usually can come up here, but because this is here, it kind of pulls backward. You see that right there? Again, makes it to where the airway is starting to get blocked because it's not staying in the position that it needs, all right? Now, clenching and grinding. How many of you clench and grind? Yep, I mean a lot of people do, they really do. And so they'll start to see chipping in their teeth. It won't look like these normal rounded edges like this chipping. So clenching and grinding could be a sign. Now for sure, if someone can get this right, I'm going to be impressed. I might give you 2 tickets. Why is clenching and grinding, how is clenching and grinding related to sleep apnea? What is it considered? Stress, what is it called? Do you remember? Or what does it do? I'm sorry? TMJ, it is related, but I spoke about it earlier. What does clenching and grinding, how does that relate to sleep apnea?
Cortisol and inflammation.
No, oh good, I'm just trying to see. What's that? Who said that? You did it. That's it, you got the 2 tickets.
That's yes. Because that's what it is. Clenching and grinding can be caused by stress, but then it's the arousal that makes the difference. So the arousal, when you clench and grind is because, remember, the arousal try to wake you up in the middle of the night. So people, that's an arousal. Like clench and grind, wake up. And also when you clench and grind, it actually opens up the airway too. So it's considered arousal.
Thank you all. That was all, that's all associated to clenching and grinding. It just wasn't what I was asking for, but the arousal was perfect. And so, yes. So now, also, if you look at your friends or family, do they have retrusive jaw or retrognathia? Meaning, if you look at this line here, do you see his nose and his chin? Can you see how you can get a pretty straight line going like this? Do you see that? The tip of the nose into the chin. But you see here from the tip of the nose to his chin out here, do you see how it's more of a diagonal? And it's recessed in? Because these tissues in the back of your throat are connected to your tongue and your jaw. So when your jaw is recessed, the tissues start to block the airway more. The tongue starts to block the airway more. Okay, so if you look at people, you're like, oh, they have a recessed jaw, you might want to get a sleep study. And this is what I was trying to get you to do, the Malin-Potty score, okay? Where the uvula is, you see the uvula here. So here, if you cannot see this uvula here, and if you look more like this where you can't see the uvula, or if you see the uvula but you don't see the full uvula, like here you can see the end of that, and it's covered almost the majority of the way, class 3 and class 4 are the biggest, one of the biggest signs for someone to have sleep apnea, okay? So you can go home and look at your pictures that you took on your phone and see, can I see my uvula and how much can I see? And the paper that I gave you on the other side shows you those different classifications. And the other thing, when you stick your tongue out, you took your picture, do you have scalloped tongue? Scalloped tongue is, do you see these little indentions right here? Do you have that? So these indentions, it's because that is the placement of your teeth. You know, your teeth are all kind of scalloped. So because your tongue can have room and is constantly pushed in by that jaw and that teeth, you're getting the scalloping, all right? Now, so if you have any of those signs I've discussed, then what do? Well, you can get a home sleep test or a sleep study. How many of you have had a sleep study before? Oh, good. So a lot of you have had a sleep study. How many of you have had a sleep study in the lab? Okay. Did you have fun in the lab?
No.
You did? It's like a little home away from home, right?
No.
No? Did you have fun in the lab? Did anybody have a hard time in the lab? Yes? Why did you have a hard time in the lab?
Couldn't sleep.
Couldn't sleep? How come you couldn't sleep?
Wires and monitors and people coming in and looking at you.
Exactly. Does anybody like having a stranger looking at you? That's kind of she might. Anybody else like having strangers looking at you and having 28 electrodes from the top of your head to your chest to your legs? So that is usually what they do. They send you into a lab to get a sleep study done. And so that's what they do. But the great thing is now they have home sleep tests. Have y'all heard of home sleep tests? Have you ever given a home sleep test? You would be surprised how accurate this home sleep test can really be. You just had one? Good. Which one did you have? Oh yes, you have sleep imagery. Yes, yes. You'd be surprised how accurate it can be. It will find out how many times you stop breathing. It's going to find out how low your oxygenation got. It's going to find out, you know, where you're tossing and turning side to side, where you're snoring. It's going to find all those things out, and in the end, the sleep study is read by a board-certified sleep physician, and they'll tell you whether or not you have sleep apnea. But the great thing is, it's kind of like our rotary phones. Now we have iPhones. How great are iPhones, right? iPhones are very technological. It's so advanced. Sleep studies are like that now. You don't have to go into a lab. So I have a lot of patients who, their husbands or their wives, they don't even want to know they have sleep apnea because they don't want to go into that lab, except for this one. But yes, they don't want to go into the lab because all the straps, all the electrodes, and someone watching while they sleep. So now they have home sleep test. It makes it super easy. It's also much more cost effective than in lab. You don't have someone to watch you while you sleep. You get to sleep in the comfort of your own home. So kind of in the same position you would be, your bed, so you feel like it's a little bit more accurate because you're actually in your bed. And then you get the interpretation results very quickly. And then of course, like I said, test your how many times you stop breathing, oxygenation, etc. All right, so treatment options for obstructive sleep apnea. So there's CPAP, oral appliance therapy, Inspire, and some patients need combination therapy. So, how many of you have a CPAP or have ever worn a CPAP? Good. So you've worn a CPAP. You've worn a CPAP. Good. Has anybody else? Great. Have you? Anybody else been given a CPAP, or told you should wear a CPAP and never took it? So you're told that you just never took the CPAP. Why didn't you take the CPAP?
I'm going to.
Oh, you're going to?
Just recent. Yeah, this is in the last few months.
Oh, so you have mild sleep apnea?
Yeah, so I'm just not sure if I really need it.
100%. And so I'm here to tell you, okay, I'm a sleep dentist, right? But my whole goal, remember I said my why? My whole goal is to help you get better. So I don't care what treatment you're taking. If it works for you, fantastic. Because honestly, CPAP is the gold standard. It is. All the doctors, they're going to tell you wear a CPAP. Okay? Now, the ones who raise their hands for CPAP, do you wear it every day? Every day, every night, do you miss ever or no?
Almost never.
Almost never. Perfect, perfect. And when you had sleep apnea, do you remember how many times you stopped breathing per hour? 10 to 15 times. Okay, okay. And then what about you? Do you remember?
How many times?
Yeah, how many times you stopped breathing per hour?
I'm not sure I got mine per hour. I think it was for
For
the
the
duration.
whole,
It
okay.
was like 80 something.
80 something? Okay.
But where am I seeing that? I couldn't sleep about
You can go sleep about, exactly. So here you're asking me. So I will say CPAP's great. Whoever's going with CPAP, I am not here to convince you to do anything otherwise. I want you to keep with it. I do. Yeah, I want you to keep with it. However, the majority of my patients that come in are people who can't use it. And the reason why I asked them what their number of times to stop breathing was is because a lot of severe cases, severe is stop breathing 30 and above. A lot of severe cases, they need something so badly. They're feeling so miserable that when they have their CPAP, it's like 90 days. Is that correct, 90 days for you? And so it definitely, yeah, and it definitely can be. So I want you to wear it. I would never say stop using it for something else. Keep wearing it. But a lot of patients I have, they have a hard time, and I'm going to explain why. So, CPAP versus oral appliance. So as a sleep dentist, I specialize in oral appliance therapy. This is what I do. Now, I'm telling you, and of course, I'm sorry, what was your name again? Gene, yes, Gene. So Gene, he's my model person. He wears a CPAP, he does everything right. You're my model person also, you do everything right. Perfect, so this does not pertain to you, okay? It doesn't pertain to you because they're great. They're using their treatment. But the ultimate goal is try to find a treatment option that people will use. And what I'm about to tell you is what patients tell me. I don't know if you deal with this, and maybe you deal with this, but you're like, you know what? I want to live. So I'm going to make sure I wear it no matter what, right? So what patients do tell me, this might be very informative for you, what patients tell me is that they don't like the straps. They don't like the mask. They don't like that when they wake up, it takes till like noon or so to get these marks off their face and getting wrinkles. They don't like that. They don't like if they're sleeping with their bed partner, they can't have like their, time because it's just not as cute as they like it to be. They don't like that if they're tossing and turning a lot, the mask can leak and they get leakage out of their eyeballs. They don't like that when they're trying to keep it clean. It's hard to keep clean, and if you don't keep it clean, I don't know if y'all have ever experienced with this before, and I don't think you would have because you're so good about it, but some people don't keep it clean every day. And when they don't, they start to get respiratory infections, so they get bacteria within the hoses, and they feel constrained. If they're waking up multiple times in the middle of the night, like going to the restroom all the time, then they have to take it off, and then when they go back to bed, they don't put it back on. So then they're not having full therapy. I had a lady and her husband, they came into my office, and husband was furious. I don't know why. People, they don't like to come in, they're just upset, they don't want to be here. I get it. We have all these other doctors we see, we don't want to be here. He did not want to be here. And his wife was with him, and I was treating his wife. And he said, I don't know why I'm here. She wears a CPAP. I don't want to be here. And I said, sir, then why are you here? I'm not forcing you to be here. Why are you here? And then she was so sweet. She was quiet. She goes, well, my cardiologist sent me because I just had a heart attack. I said, okay. So let's talk about this. Your husband says you wear a CPAP. She goes, I do. I said, you put it on every night? She goes, I do. I said, okay. And she goes, but I do take it off. And I go, okay, well, let's talk about that. I said, what time do you put your CPAP on? She goes, I put it on at 10 p.m. I said, okay, what time do you take it off? And she said, you take it off. She said, I take it off at 3 a.m. But sometimes, some people wake up at 4 a.m., 5 a.m. I go, what time do you wake up? Like, what time do you wake up out of your sleep? I wake up at 10 a.m. So from 3 a.m. to 10 a.m., there's no therapy. She stopped breathing 28 times an hour. So if you can imagine that, your body is struggling. So, but even after that, he goes, I told you she wore CPAP. Yes. You're wearing it, but you're not wearing it. You're not being consistent with it, okay? So it's like you wear it, but as long as you wear it every night, all night, the full night, so you're getting therapy, fantastic. If you're not, then there's something we need to look into, okay? And so CPAP, the reason why I say don't change, because it has a high success rate. It really does. But I'm a big researcher, and the research shows, unfortunately, that the compliance rate of people wearing it every night, all night like they're supposed to, is 47%. But it actually drops down to 17% after the year. That's research, okay? Now, what I told you, people suffer with claustrophobia, skin irritation, leakage of the mask, dry mouth, and travel too. How many people like to travel? Or how many people travel? Yes? You like to travel. So when you travel, you probably notice you have another suitcase, you gotta find distilled water, and if you're going camping and things like that, you gotta make sure you have electricity, so you have to make sure you have those things. When an oral appliance, it's just very simple. You don't have to have any of those things, okay? So, and when it comes to oral appliance, and I know you were saying you just got recently diagnosed. You said you're 10, you said you're mild, right? Mild. So mild to moderate cases, oral appliance therapy, its success is literally neck and neck with CPAP on mild to moderate. If it's severe, that's different. Severe, the success is not as high, but do I treat severe cases? All the time. Because if you're not using your CPAP, I don't care if you're severe or not, if you're not using your CPAP, you're getting zero therapy. So let me help you as much as I possibly can. And we can talk about adjunct therapies like weight loss. I can drop those numbers from severe down. I had a patient, he stopped breathing 77 times an hour. 77 times per hour. That's why I asked you, was it per hour for the whole night? Is it 80? It could be per hour, because I've had patients who literally stop breathing 100-something times an hour. But it's 70 times an hour. So normally with sleep apnea therapy, with oral appliance therapy, what is considered success, according to the American Academy of Sleep Medicine, is if you're using an oral appliance, are you able to get that number down by 50%? And are you allowed to relieving symptoms? In other words, you have a patient who's 77 times and per hour, but he was snoring like crazy, he wakes up 10 times a night, but then now after treating him with oral appliance therapy, his number gets down to 30-something, and he's not snoring anymore, he's not waking up anymore, he feels more rested. In the American Academy of Sleep Medicine, they consider that success when you come to oral appliance therapy. I mean, wouldn't you consider that success too, though? Because at least you're not waking up so often, you're not snoring, you feel more energy. That's really why a lot of people come in. So that's considered success. So my patient who was 77 times stopped breathing, he actually calmed down, because normally with patients who are severe, I will recommend dual therapy, meaning CPAP and oral appliance. And the reason being is, remember, when I say oral appliance, what does that do? You have that airway that you breathe out of. The tissues in the back of your throat start to block your airway. When it blocks it partially, what is that? Does anyone remember? What is that? Who said that? Okay, did I give you a lottery ticket already? I gave you one. Who else said it? I'm just seeing who's listening. Did you say that? There you go. Snoring, yes. But then when it blocks it fully, what is that? What is that called? Yes. Who said that? Who said? Anybody else? Yes. So apnea, right? So what does the oral appliance? Well, let me go back to CPAP. What does the CPAP do?
You have that airway, and it blocks your airway, then the CPAP blows air, not oxygen, but air hard enough to push the tissue out of the way to get you to breathe. That's what it does, okay? But the problem is a lot of people have a hard time with the pressure, because if they have severe sleep apnea, it's really a lot of pressure. It feels like a jet engine, and they feel very dry and have a hard time. So, but that's what CPAP does. But in oral appliance, when you have the tissues block your airway, the oral appliance actually moves the tissues out of the way this way. Does that make sense? Can you see that? Moves it this way instead of pushing it down. So when it does that, if you're severe, maybe it will move it only this much, and maybe not all the way, okay? So this much. But now, if you only have this much tissue, do you think you need more pressure or less pressure to finish that tissue? Exactly, less. And so people can do dual therapy. So if they're not getting full therapy with just the oral appliance, then they can have a CPAP, but now the pressure's a lot lighter. So it's a lot easier to handle, okay? So I put a lot of people on
Dual therapy for severe, because again, my whole goal is to help them get better to the max that they're willing to do. So that 77 patient, he actually got down to 7 times not breathing. And that was with no CPAP, that was only oral appliance, okay? But I would try to get him on CPAP in addition. He wasn't having, he was a soldier. He had PTSD, he couldn't handle the mask, so he wouldn't do it. So, but that's what I'm trying to say. Just because you're severe, and if you're not using CPAP, I wouldn't just stop there. Try to find help, okay? And so then, let's go on to this. So what is an oral appliance? It's a custom fit mouthpiece. So if you look at this here, here's an example. So you can see it fits in my hand, okay? And I don't have very big hands, but it fits in my hand. It's not over your face, there's no straps, no mask, no hose. And so the great thing is, with this, because with CPAP, majority of the time you really should be sleeping on your back because it kind of holds that in position. But real with sleep apnea, a lot of people, you want to sleep on your side or propped up because that's positional therapy, it opens up the airway better. So with an oral appliance, you can move side to side, back, upside down, whatever. You can move in whatever direction you want. The other thing is to keep it clean. I don't know how y'all keep yours clean, but some people say it can be very difficult or cumbersome to keep clean all the time. Oral appliance, it's literally toothbrush and soap. You brush it, you rinse it, you store it dry. That's all you do. So moving side to side, when you go to the restroom, you just go to the restroom. You don't need to take off your oral appliance. So go to the restroom with the oral appliance and go back to bed. So very, very simple there too, okay? When you travel, it's just a case. There's no distilled water to find, electricity to find. My hunters or my fishermen, things like that, they don't have electricity all the time. They can just take this and go, all right? So all the effects that CPAP might have, the oral appliance can have an answer to. And so what does it do? It's custom fit to every nook and cranny of your teeth. And when it does that, it holds the jaw in the same position or forward, all right, to open up the airway. That's how it works. And so for patients, for me, I make it custom. I have them come in. I have to look at their airway. I have to look at their teeth and find the right position for the oral appliance and also find the right appliance, okay? I've done them all, but the ones I have are my absolute favorite, but there are reasons why I choose different ones, okay? So see, it fits in the palm of your hand. All right, Inspire. Has anybody heard of Inspire? Yes. Does anyone have Inspire? No. Okay, so Inspire. Inspire is a surgical option, okay? It is an option. What it is they cut. And they cut through your chest wall. You see this right here? They cut through the chest. It has an electrical lead that goes through your neck to your tongue. You see it says hypoglossal nerve here? That's the tongue nerve, right? And so what happens is, every time you stop breathing, it sends an electrical impulse and it has you stick your tongue out. That's what it does. So you're like that. Now, that's really what Inspire is, okay? And so it can leave little scarring around the neck and around the chest, but it is an option. And so I'm not opposed to it at all. You know, I want options that patients will use, except the only thing is I want research. So your CPAP, it's been around since the 1960s, a ton of research. Oral appliance therapy has actually been around since the 1970s, okay? So it's still a lot of research. Inspire has been around since 2014. So still not the most research, but is it an option? Yes. Am I opposed to it? Not at all. So normally when I refer for Inspire, which I do, because patients, when they come in, I want them to choose what they feel like is best for them. When I refer for Inspire, then patients will go, and then the ENT, that's usually who does it, they'll say, okay, well, have you tried all the non-surgical options first? Have you tried CPAP? Have you tried oral appliance? Because they say, once I cut, there's no going back. And so, but that's what Inspire is, all right? And so, going back to my journey to sleep dentistry, it's all because of this beautiful lady here. This is my assistant, Camilla. She started with me a long time ago. She literally came into my office and she was crying. She's not a crier. She's stern, she's strong little strong mind. And she was crying. I said, what is happening? And she said, my dad just had a heart attack. I said, okay. And she's a researcher too. She loves to research everything. And later, she came in because I was drilling and filling, doing everything, drilling. And then she said, Dr. Thai, did you know that dentists can treat sleep? I said, I had no idea. So we went to classes. And then every class I went to, the more and more I learned, the more excited I got. I said, oh my gosh, this is so amazing. how can we help these patients? It's really awesome. So she's my biggest reason why I started. And so when I approach treatment, remember how I told you I approach it like family? So these patients are all patients that have come through the practice, but I love when they bring their husbands and wives here. I love if they don't have their husband and wife, they have them on FaceTime here, because you know what? It's good for your husbands and wives to know what's happening with you. Sometimes we like to hide it, and we think it's better to hide, but you know what? Sometimes it works in your favor. Because do you ever have husbands and wives that say, why are you so irritable today? Why are you not yourself? Why are you so lazy? How come you don't want to go mow the lawn? How come you don't want to... And they may not know that you don't breathe at night. They may not know that you're so extremely tired. They think, well, you were in bed that long. Why are you not helping? But when they're in there, when they're in consult, we talk about it, and you start to see a change. I'll see a change in the husband and wife. They're arguing, and by the time my consult's finished, they look at each other, and they're just like, I'm sorry, and I didn't know you were going through this. Let's try to get you help, right? And so I love having husbands and wives in because I want them to see what is happening to each other. So I do complimentary consultations because I just want to talk and find out what's happening. But then I offer information on all treatment options, just like what I just did. And then at the end, we have informed decisions that will lead to compliance. Because how many times have you been told to do something, but you just don't do it? Does that happen? Do you do everything your doctor tells you to do? If you do, I would be super impressed. I'd be very proud. There's a lot of tickets everywhere. But so sometimes we don't, right? And so, but if you made a choice, if you decide to do it, do you do it better because you made that choice? And usually people do, because that's what I feel. I feel like if the patient has an informed decision and they make that choice, they're much more likely to use whatever treatment option they have. And that's what I want. That's the whole goal, is getting treatment that you're actually going to use every day, okay? And so, how many of you have experienced this? Dental questions? Do y'all love it? So yes, so dental impressions, usually when you're doing an oral appliance, you kind of start there, right? But the good news is, at my office, I don't use dental impressions. I actually scan. And so it's so much better in the sense that they're not gagging. Did y'all gag when you had dental impressions? And what did the assistant say? Well, we're almost finished. And you're thinking, oh my gosh, when are they almost finished? They're not finished yet. You're still gagging me. Well, the great thing is there's no gagging because we're scanning and we're getting a really good fit and very custom and scanning all the nook and crannies of the teeth. It's less invasive. It won't pull off crowns. Have you ever had impressions where it pulled off your crown or anything like that? Some people have. Some impressions pulled out teeth. So that's happened before too. I've experienced that with patients. And so you see that. So it's quick, and you scan it really quick, and it's better than trying to wait for that dental impression to set, okay? And a quicker turnaround from the lab. So it looks like this. So it'll come out and it'll look like this. And you'll see it on the computer as it's working. And so we are almost done. I'm so proud of you. I was thinking the sleep disorders, people are going to be falling asleep. That's what I thought. But you guys have been amazing. So we're almost done. So she's Miss Baldwin. She's so sweet. And so I just love her. She came in yesterday, really. And I said, take a picture of us, because she's just a huggy person. And that's what makes me happy. This is why I don't have blood spit in my face. So it's really nice. And I get to give hugs, and I get to hear how well they're doing. When she first came in, extremely exhausted. Now she says she has so much energy. She's not getting elbowed by her husband because she was snoring like crazy before. She stopped snoring. And so she just came in for a follow-up and checkup. And so this is what we do. When we're starting your sleep journey, it's not just the oral appliance. We do the oral appliance, but then as the airway is remodeling, then I adjust the device because you have to. Because when you have an airway and no oxygen, it will be swollen and inflamed. And then once you start the oxygen in, the tissues will become less swollen, less inflamed. The airway is going to remodel and change. When the airway remodels and changes, we'll be adjusting the device. Does that make sense? Because no one airway is the same. They're all different. So we go by symptoms, we look by snoring like that, we look at sleep diaries, all those things, and then we do follow-up visits to discuss. And then, at the end, we just take care of you. That's all we want. We just want to take care of you and make sure you're doing better. And God, I have patients who I'm constantly researching. If I don't know the answer, I'm going to try to figure it out. So that's what we do. So I'm going to leave you with this last story. So this man, does he look like a sleep apnea patient to you? He's not my husband. He looks like my husband. Oh, you're right. But anyway, so a lot of people think sleep apnea patients are bigger, obese. It is not the case. It doesn't always have to be that way. So my husband, this is my husband, she is correct. She is correct. This is my husband. So my husband, let me tell you, he snores, he can knock these walls down for sure. You ever go, men, like, your wives complain, but then when you go on your fishing trips or camping trips, the guys, they don't really say much. My husband, he can't go on guys' trips. All the men complain. They say, you better get another hotel room, you better sleep in another bed, because they're not sleeping. It's that bad. It's so bad, but I must love him tremendously because no one, when we go on trips with our friends, no one can be in the same room. But they say, how in the world? I was like, I don't know, I'm a really deep sleeper. I have to sleep first. If I don't sleep first, it's over. I'm never sleeping. But when I sleep first, then it works out fine, at least I think. So, when I learned about sleep apnea, I said, baby, you need to get a sleep study because you snore like a freight train. And of course, when I was sleep apnea, I talk about this all the time. I talk about it to my son, I talk about it to my family, and so I do all those things. And my son can literally be on the plane, and a man next to us will be snoring like crazy, and he'll be like, Mommy, give him your card. And he was only 6 at the time when that happened. So he's learned all about that, right? So anyway, my husband knows all about sleep apnea because I talk about it all the time. And he goes, I don't have sleep apnea. He goes, my friends call me Sunshine. I don't know if that's a compliment or an insult, but they call him Sunshine. He says, I feel great, I'm not tired, I don't have excessive daytime sleepiness, I don't have hypertension. He has none of those things. And I said, but baby, you knock down walls, you rock the house, I'm telling you. And he says, fine, test me. Talk about someone, I'm trying to help him. So he got tested. And when he tested the first time, it said he stopped breathing 25 times an hour. 25 times an hour. And he goes, excuse me. He said, that's BS. But he said the other word. And I said, honey, it's saying, they're saying. He said, I don't believe it. I said, okay, let's try another test. Another sleep study. Not the same sleep test, a whole other sleep machine study. And it said he stopped breathing 28 times an hour, okay? And he goes, I still believe it. I'm sorry, I don't. Oh my gosh, how many times? And so finally, last one, 30 times an hour. Now he's severe. Remember I said 30, but I was severe. He's severe. And so he was like, oh God, fine, what are you gonna do? I said, remember I told you severe? No, I'm gonna put you on CPAP. Because my whole goal is to have the high success rates. So I put him on CPAP. That first night, he said, to hell with this. I'm not using it. He said, it feels like a jet engine. He goes, I know I've always dreamed of being Maverick from Top Gun, but I am not wanting to do this. He goes, I'm not going to do this. And so he said, I'm not doing it. And I said, well, what are you going to do? Because you've got to live, and you've got to be around for our family. He said, make whatever you make. Whatever that thing is, just make it. So I made it for him. And I made the appliance. And the very first night, now this is not everybody, but the very first night, I thought, he's dead. He's dead. He didn't move. Nothing came out of his mouth. I was like, you are dead. And I looked, I was like, I put my ear next to his breath so I could see him breathing. And he was breathing and breathing well. And I thought, this is the best sleep of my life. Well, at first it wasn't. When I thought he was dead, it wasn't the best sleep of my life. But then, this is the best sleep of my life. And then he kept wearing it. Night after night after night. And I thought, oh my gosh, I did not know what sleep was until now. I told you I was sleeping with him before. And then he went on a business trip. And when he went on his business trip, I thought, I know him. He loved it. Because because he's worried for me. You know, he worried for me because he wasn't snoring and I was super happy. What, happy wife, happy life, right? So I said, he worked for me. But then, so whenever he left, I went looking around his sink. I said, oh my gosh, where is it? And I couldn't find it. I was like, oh no. And so I called him. I said, where's your appliance? Did you throw it away? Because I don't see it. And I know you're in a hotel room by yourself. Well, you better be by yourself. I said, where's the appliance? And he said, I took it. I said, why? Because he was so adamant that he had no problems. I said, why'd you take it? I told him. And I said, really? He goes, I'll tell you this, honey. I went out when I took some clients out and I went back home and I did not wear my clients because it was late. I forgot to wear it. I'll tell you, I felt miserable the next day. He goes, so now I'm your biggest cheerleader. I will tell everyone about it. Because now he's really my biggest cheerleader, okay? And so it's great. So I was so happy he finally listened to me for once. But in the end, ultimately, that's all we want to do. I want to help you sleep better and live longer. Thank you so much to everybody for being here today. All right, thank you very much.